All right, it's time to take a look at some of the stories making headlines in Nigerian newspapers. We have joining me now Chartered Accountant and Public Affairs Analyst, Sheson Okwade. Sheson, good morning. It's good to have you join me now.
Morning, Mike. Thank
Great.
God it's Friday.
All right, let's get into the papers. Now, Daily Trust is where we start from. Daily Trust says on COVID-19, our self-isolation policy has failed. That's the federal government is saying this, and it was designed to fail. Experts are replying to government on there and has some other riders there. Now, from there, let's go to Blueprint. The Blueprint newspaper says violation of interstate travels worries federal government as certainly displaced Almajiri movement or the Almajiri move to Cross River and Ondo State. All right, and Benue intercepts isolate 14 cops, and certainly has other headlines there that you can also see to know what's going on. From there, let's go to the News Direct. News Direct, fallout from the COVID-19. Minister admits failure of initial self-isolation policy and says patients will not be treated by herbal doctors. Nigeria records highest cases of 381 and 10 aides of Sanwo-Olu test positive. All that on the front page of the News Direct. National economy is next now. Africa's travel and tour industry seeks $10 billion relief to rescue sector as UN foresees 80% international tourism plunge due to pandemic. That's the national economy. Now, Leadership newspaper is next, and it says coronavirus, 44 million Africans will be infected if, and WHO is warning there and predicts 190,000 deaths, many years of virus spread, and PNB waives VAT on medical items. All right, my guests will be interested in this story when we start. Then from there, let's go to Daily Times, which is the last paper we're seeing now, COVID-19. Federal government warns against unauthorized treatment, wants patients to follow healthcare providers' recommendations, says 21 labs now operational for COVID-19 testing in Nigeria or nationwide, as the case may be. All right, Sheson, let me bring you to the story on the front page of the Leadership newspaper. It says that 44 million Africans will be infected. That's the WHO warning there, and predicts that 190,000 deaths will be recorded and many years of virus spread. Now, this is really scary with the numbers increasing in South Africa, Egypt, and Nigeria, amongst other African countries here and there. What do you foresee, or how does this come to you?
Yeah, thank you very much, Mike. The WHO has given us a kind of prediction in which in financial terms at times we call budget to guide you. If they are projecting that we're going to have about 44 million people infected, you and I can see the rate at which the figure keeps increasing every day. As at last night, the figure was about 381, the highest so far, and it's based on the fact that we are increasing the test capacity day by day, and from there we are able to know the people that are. But the challenge I'm faced with, Mike, is the government are actually putting in their best to make sure some of these things does not go here and there. But we are not getting the cooperation of the people at all. Take, for example, there is an interstate lockdown, and so many people are not adhering to this. We believe that we need so much to do. We want to live so that we can earn a living. But we've forgotten that it's only the living that can earn a living. So when you are dead, you are no longer there. So people are not adhering to the interstate law. Even the governors who sat down to address this, that they are going to have an state lockdown, are not complying. They are the one moving Almajiris from one state to the other. Look at what the governor of Kaduna said. He said out of the 59 Almajiris that was moved to him, over 50 are tested positive. Imagine if those people are taken to their houses of an average of 5 people in a place. That's a multiplier effect. And that's just their immediate family alone. What about the friends, the people? They are children, they are teenagers. They will definitely mix with people. So it's not about government doing so much, but about we, the followers. Adhering that it's not about the government that will die. It's about an individual that is infected that will be traumatized, and at the same time I end up in the dead. So I think the WHO has given a guide for we, and we should adhere to the safety precautions that we have given. We don't pray that we get to that number because that's huge when you talk of that number. But if we don't exercise the precaution stated, we might see ourselves there.
All right, as it is critical right now with the numbers increasing, government is certainly relaxing, partially relaxing some of its restrictions. But there are calls that there's a likelihood that a strict restriction or even maybe a national emergency going forward can be implemented going forward. What do you see from that window?
Just this week, with the ease of the lockdown, is just for a 2 week window where they are going to review the process. Mike, with what we are hearing every day and with the increase, I was telling some people that after these 2 weeks, I might see us going to total shutdown because the rate at which the thing is moving, it's even alarming that people are not even confident of their health status again. Because if what we are getting is from the test result, and look at the number we've tested, just slightly above 20,000, and we are having that number. Imagine when we start increasing the test capability, and we are going to test about 100,000. Imagine that means we are going to have times 5 of what we've had now, and it's going to be critical. So what I think we can do is let everyone adhere to the safety precautions stipulated by NCDC. Wash your hands thoroughly. Avoid handshake. It's when you are alive that you can hug or shake somebody. We should adhere to it. We should maintain. In fact, you see, there is misconception with this social distancing. As far as I'm concerned, we should target physical distancing. Don't go closer to someone. When you talk about social, people might be thinking maybe social gathering. Even when we are together, don't come closer to me. Maintain certain distance. Use your nose mask at every point in time that you need to go. It's not for fashion. What people have turned it to be is to go and sew Ankara that will match their clothes and put it at their door. They are not covering their nose. They are not covering their mouth. If we observe that this thing is deadly, we should and we will definitely take precaution. So I feel people should adhere to this and ease the pressure, knowing fully well that the health workers that we are not commensurate to the number of people that will be treated. And they themselves are now being infected, which now pose more threats to what we are having on ground.
All right. The culture and the religious activity within the people, what they have known over the centuries and over the years and decades, now it becomes a little challenging to get used to greeting people without necessarily getting close and all of that, in as much as that is meant to be done right now. But away from the cities like Abuja and Lagos, in many other states, we still see people mingling as normal. How does this compound the situation? Is it the culture of the people that, because we're used to being communal in our nature as Africans, is that what is compounding the issue here, making it difficult for social distancing, for instance?
Yeah, Mike, it's one of it. And like you and I know, change is a difficult task for anyone to achieve. But what I want to say is that in the midst of it, even in the remote areas, there are elites who are very much aware of what is going on. And you just need a man to cause a revolution in a particular area. So if you have respected people in a particular area that are adhering to it, they are followers. What they need to know is that, Oga is not attending to any, Oga is not allowing. So if Oga is doing this, please, I want to say. And before you know it, you definitely have followers who will follow through, see through, and make sure that this thing is minimized. We need the elite, those that are enlightened, those that are there to make sure that they pass the message even to their drivers, The drivers will take it home to the wife will perpetrate to the children, and the children will say it to other people. That is how we can encourage this announcement and put an end and minimize this pandemic that we are facing.
All right.
Because really, really horrifying.
Okay, we have to leave it here now. Sheson Kwade, thank you so much for your time on the program. Thank you.